numbers and the risk they pose to humans.
Now, Minister, talking about our environment and Lassa fever, some years back while we were growing, there were these head workers that normally go around the villages to ensure that people keep the environments clean. From my findings, it's like they are almost non-existent.
I think even adding to that, there's a deficit in the number of these health professionals, these health workers, because recently I had a chat with one of them, and they're actually grappling with that challenge of having more people come on board. And I asked the question of why is it that it's only when there is a disaster outbreak like this we get to know about them. So is there something your ministry can do while you are?
And to also ensure that we recruit more and spread them around so that we can be able to help with Lassa fever control.
They had actually complained, the environmental health officers have complained that they are not being employed. Because we had the registrar some times back, he said the local governments are not employing them, and we know their roles in sanitation, hygiene, and all of that. The roles they played back then as Wole Wole, Dubagari, I don't know what they are called in Igbo language. Why are they so scarce these days? And our disease burden keeps increasing, and we need them. Why are they not being employed?
I think, that's a question that's open to any kind of a guess. I think, if you ask me, that at a certain period in this country, we began to look at healthcare. I think probably at the time we had a lot of income, we began to look at healthcare as being large hospitals in large cities. And people were competing or rather states were competing in building the largest hospital, and they were very proud of how big the hospital was, and began to forget about the small cities and the villages and the primary health care, and they fell into neglect at the time. And it is this regime that's actually refocusing on primary health care, on taking health care from the foundation. And the foundation is at the community level. And that's where most of all these indices we are talking about occur. The maternal mortality, the infant mortality, not at the high-end hospital. And if you don't address that level, the indices will be bad. But we took our eyes off the ball at a certain time in the history of this country, and the large hospitals are not able to solve problems in rural areas. So the policy of the government now, the present government of President Buhari, is to go back to beginning, have at least one primary health care center in every political ward. That will give you nearly 10,000. At the moment, we have about 4,000 functional. We have about 5,000 or 6,000 not to go. And in the meantime, we have also changed the design from primary health care center that works like an office from 8 to 3. We want something that works around the clock, that we work in shifts. We have quarters for staff. We have electricity, because many of them now don't have electricity. We have probably solar-powered electricity and water. And if you do that, you're able to attract more staff and render much, much better service. And the primary healthcare center is a fantastic platform from which to carry out a large number of interventions.
And talking about these interventions, let's look at funding and also public-private partnerships. I know that the ministry entered into PPP with life savings chemotherapies treatments to reduce costs and access care sometime last year. And there are also other interventions that for the cancer chemotherapy is about 50% reduction. And then we also had the hepatitis and other diseases of about 1.3 billion naira. These are, part of the PPP interventions and all of that. But if the ministry must ensure this primary health care for effective service delivery to the general public you're talking about, are there other, aspects we should be looking at? Especially now that we're trying to battle Lassa fever, funding is also a challenge.
Yes, to go back to a primary healthcare center, I said just now that it is an excellent platform to carry out very many interventions, which include what we are talking about now, the sanitary inspectors, the health inspectors,
environmental health workers,
for hygiene, sanitation, domestic hygiene, food hygiene, advice on nutrition, on baby care. That is the excellent platform from which you can do all of that. And also disease finding, case finding. If you're looking for cases of TB, or you were asking just now about the finding coronavirus in the villages, if you had healthcare workers there who were trained at that level, they'll do it much faster than anybody sitting in the state capital or sitting in Abuja. So this platform is what this government wants to build, and we need the infrastructure, we need the human resources, and we need the amenities to set them up, the organization and the funding. Now the funding is the question you raised.
Yes.
The government source of funding is the National Health Insurance Scheme, which is undergoing changes because it's going to be transformed into a scheme that is mandatory for Nigerians to join, and working with the state health insurance scheme to raise enough money to address a large number of diseases for all those who enroll in it.
So are we good to go with the amendment of the Act now?
Well, it's still undergoing some work, and in the National Assembly, we have been told by the parliamentarians that it will be ready soon, but I think there will be a public hearing before it goes to the final level.
Okay, there's no doubt about the fact that the federal government is making concerted efforts, at driving, repositioning primary health care. Could same be said about the states and local governments?
Well, that's where there is a problem.
What do we need to do to get their buy-in, total buy-in?
Indeed, the health, as you know, is not on the exclusive list, it's on the concurrent list, which means that the state governments have a role to play and local governments have a role to play. And the extent to which these roles are played varies enormously, and the resources that they bring in vary also. I'm not sure if it's because they don't have the resources or they have other priorities. I'm not sure, but the primary health care is technically under the local government, and it's not really under the federal, but the primary health care development agency is an organ of the federal government to support primary health care, because primary health care, without it, secondary and tertiary will not work. So the developing primary health care is an extremely important undertaking to also assist and reduce pressure from tertiary health care. Now, the one we have not mentioned is secondary health care, which is actually also the responsibility of state governments. And secondary health care, we envisage as little cottage hospitals, 30, 40, 50 beds, and not more, with enough doctors to receive referrals from primary health care centers. We're looking at least one in every local government area, which we are urging the states to actually work upon, rather than build big hospitals and teaching hospitals. That's federal government's work. But the states, if they will develop the secondary healthcare level, so you have a middle ground between primary and tertiary, to take away a lot of the cases that don't need to go to the university teaching hospital. You could reduce the pressure and they could focus on a lot more difficult issues. So we are looking at strategies and being able to engage the states to develop secondary health care.
And I know you're very passionate about universal health coverage. And if we've heard cases of people complain about the NHI scheme not really being effective, and just saying what people have confirmed. Now, I don't know if the ministry is also looking at overhauling the scheme, because if the essence of NHIS is to meet the most vulnerable people who cannot afford this cost, and they're not getting the benefits of that scheme, which is supposed to be part of their rights as citizens. Now, should there be an overhaul? That's one. And two, a lot of them cannot, I'm talking about the grassroots now, they cannot afford to pay some of their bills. The scheme covers some certain persons in society. That's where I'm driving at. What about those vulnerable people who are left at the mercy of healthcare providers?
Well, the reason why the perception is there that the National Health Insurance Scheme is not functioning is that it attends only to the formal sector, which is less than 5% of the population. Those who are in government or who have jobs with companies who enroll with NHIS. But that's why its mandate is being expanded to now compulsorily or mandatorily register more people, so it can cater also to the needs of more people. And to do that, it has to trickle down to states who now have created state health insurance agencies or schemes, or what they call them, who now work together with the NHIS. Now, the concept will eventually produce a large pool of resources from which a treatment can be given to many. And there will be those vulnerable ones you mentioned who will be exempt because insurance is paid for them through another scheme.
Okay.
From the present permutation, we're looking for 15,000 naira a year per head, which the NHIS is looking at as contribution per year, 15,000. So if you do that, you are covered, and that will give you the pool that we're looking at. I think that 15,000 is affordable to a large number of people for healthcare in a whole year. So
yeah, I think beyond what government is putting on the table, there's still the issue of getting a sustainable funding mechanism, for the health sector. For instance, for the health insurance, and a lot of people have said, why can't we tax, for instance, GSM service providers? Why, we can tax them. It's an alternative. A lot of people had said we could generate, such funds, tax them. Even, tobacco companies. We can tax them. So people always, when they make this suggestion, I'm just wondering why it is difficult to explore such, alternatives.
yes, it's been done in several countries, and Nigeria has been looking at it. It's not that it's not, but it requires a law, and that law will have to be made. Those are what you call the sin taxes for luxury goods, for alcohol, tobacco, and so on. They're called sin taxes. And some countries collect such amounts into the treasury. Some dedicate that amount to the health sector, depending on which one is adopted. It has been discussed in Nigeria, and they probably come up at some time to raise taxes on luxury items and dedicate them to the health sector. It is a work in progress.
Okay, Minister, to say something.
I know our listeners will be keen to hear you us talk about the issue of the hospitals and the HMOs and the main health insurance headquarters. Now, as journalists, what we found out is that hospitals complain that HMOs don't pay them in time. Now, that's where the issue is. And so they give poor services to health seekers. Now, is there any way we can do away with the middlemen, that's the HMOs?
Well, that is a question that the National Health Insurance Scheme, which is an agency, should be answering. They have developed various scenarios that would address that problem we are talking about, because it is true that there are complaints here and there about the HMOs and payments and those who provide service, and sometimes that led to quite a lot of arguments that we have had to wade into. But again, the health sector, particularly also the health insurance scheme, is a work in progress. There's a new law coming up to expand it, and at that time with a new strategy will come up. I've had a conversation with the executive secretary on a new approach that we're looking at to solve these problems.
Okay.
We have had discussions. It's still in the early stage, of developing a new concept, a new approach that excludes a lot of the problems we are seeing now.
All right, we're almost rounding up. So
cancer burden.
It has to be your last question.
Okay, fine. Cancer burden in the country remains a huge challenge. And I know that Gavi, that's the Global Alliance for Vaccine Initiative, had issues. They are the custodians of vaccines, talking about partners now. For cancer, it has been established that if you get the HPV vaccine and you get to immunize young girls before they become sexually active, you will have succeeded in tackling or dealing with the issue of cervical cancer. Gavi had issues with Nigeria, and thanks to Mr. President, Nigeria was able to resolve that, and there's a renewed confidence in the country from Gavi, such that even the leadership of Gavi visited this country last year. I'm interested in knowing the possibility or the difficulty in getting Gavi to consider Nigeria as a beneficiary of the human papilloma vaccine for girls.
Yes, it is in the program.
Have you been talking?
Oh yes, we are looking at it. It is one of the antigens we are looking at for human papilloma virus vaccine. It's something that we are looking at, but all these things have financial implications, and you have to prepare the money before you make the order. But it is on track. We have a particular arrangement now with Gavi that ties us over the next, I think, 8 to 9 years remaining. They brought $1.03 billion, and Nigeria brought $1.97 billion on the table to cover a range of vaccines for the next, it was 10 years when it was signed, but I think it's about 8 or 9 remaining, which will provide the range of vaccines that we're looking for. And both the rotavirus, which is also extremely dangerous because it is responsible for the diarrhea that kills a large number of children. Okay. It's on the program too, and various antigens that will solve basic health problems, which we look at as preventable. As we say, it costs money, but at the end of the day, prevention is cheaper than the cure, and also better than cure.
And talking about this prevention as we wrap up, I want you to tell Nigerians, if there is hope, we were able to conquer Ebola, we conquered Lassa last year, we're just starting the year with another Lassa. What is the hope for Nigeria? Well,
the hope is good. The future is bright. This government is doing very well. It's on track. It's investing a lot in human capital development. The health sector is key to the president's heart, and particularly the basic health care provision fund, which has been released to the health sector, which we are working on implementing right now. So there's hope, but we need to be able to carry out a lot of reforms in the way we look at things and change the way we view. We can't continue using one method which doesn't work because they say, oh, that's the way it is. The general order of service must undergo modification. Many countries have changed processes. Okay. 2-3 times, while Nigeria has remained on one process. So things have to change. We have to carry out reforms also in the health sector and the hospital sector. And I'm happy that the health insurance is doing that, primary health care is doing that, NCDC is doing that. So we need to get on with the other agencies.
Thank you very much, Dr. Osage Emmanuel Ehanire, the Minister of Health. Thank you so much for your time. I know, Hassan, you want to ask a final question, but we don't have time. We're out of time. Thank you so much. It's been nice having you on.
Thank you for inviting me.
And yes, Nigerians will definitely sync with everything you have said here on the platform.
Thank you.
Also thank our panelists, Hassan Zegi. He is the President, Association of Nigeria Health Journalists and Health Editor, the Authority newspapers. Thank you very much for your contributions. And also our very own Rabi Abdallah from there. She's the head of the Health Desk, NTA Network. Thank you so much.
Thank you so much. Pleased to have you.
All right. So for the past 50 minutes and more, we have been looking at the health situation in Nigeria, the challenges and way forward. Of course, you know, like they always say, your health is in your hands. And the minister has talked about precautionary measures the federal government is putting in place, talked about collaboration with other ministries to ensure that we put a stamp and saying no to Lassa fever and no entry to coronavirus into the country. And other health issues are in progress. That's what he said. So we'll definitely continue to do our best as a nation to ensure the prosperity and growth of this great country, Nigeria. This has been Platform. I am Ruth Aguwele. Thank you so much for your time. We'll get to see you some other time. Bye.